Okay, so I'm probably gonna get a lot of hate for this video, but it's my personal opinion that tension headaches do not exist. And I'm gonna tell you why. My name is Dr. Saver. I am a double-boarded neurologist and interventional pain doctor, and I've been seeing patients with headaches for the past 4 years as an attending. My personal belief is that tension headache a lot of times is a misdiagnosis, and I think that that diagnosis leads to more harm than good. We're depriving the patient from a lot of treatments that would have been an option if they were diagnosed correctly. Okay, so according to the literature, tension headache is supposedly the most common type of headache, with a prevalence as high as 50, 70, even 80% depending on the study. Now, most providers follow what we call the ICHD-3, which is the International Classification of Headache Disorders. I personally don't like to use it because I think it's just very descriptive and not geared toward pragmatic treatment for patients. Per the ICHD-3 criteria, tension headache is basically bilateral, non-throbbing, usually mild to moderate in intensity, and tends not to be associated with any nausea or vomiting. A previously used term for tension headache was actually cervicogenic headache, which I find interesting because tension headache to me is almost like the fibromyalgia of headaches. Okay, so why am I saying what I'm saying? From the thousands of patients that I've seen who were labeled as a tension headache, my suspicion is that the majority of them have a cervicogenic headache, essentially a headache coming from the neck. And the idea behind that is that if you have a lot of tension in your neck or traps or any of the upper back muscle, over time that will lead to irritation and inflammation of the occipital nerve, which you see in yellow right here. And then the second category of patients are basically patients who are having a migraine, but perhaps a migraine that's not severe enough to qualify for the criteria of a migraine yet. If these tension headaches are being labeled and diagnosed correctly, then that opens up the possibility of having either occipital nerve blocks, which help a lot with both migraines and with cervicogenic headaches, or potentially Botox injections. And we do inject in a lot of these regions like the occipitalis muscle and the traps and the cervical paraspinals. But these are not going to be options available to somebody misdiagnosed or labeled as a tension headache. And that's why I think that the harm exceeds any benefit of using that diagnosis. Just want to emphasize, these are just my personal views. This video is only for educational purposes. This is not medical advice. So make sure to talk to your provider about your specific case. All right, I hope I didn't create a lot of enemies with this video. Let me know in the comments below and make sure to like and subscribe.